Hi, I'm Janae Sharp, the founder of the Sharp Index. And today we're meeting together to talk about physician burnout and an event that's coming up. Um, so I invited, do I call you Kelly or what do I?
You can call me Kelly. Kellie Stecher. Kelly,
Okay.
whatever you want to do. Yeah.
Okay. With Kellie Stecher. She's a physician.
Yeah.
And I wanted to sit down with you and talk to you about your work in the space and about the event. Because I can't go because I just moved.
Well, thanks so much.
You're,
You were breaking up. You were freezing and breaking up.
I'm not. My computer.
Okay. Okay, on mine. Okay, then I'll just go now.
It
Okay, we
only
can
freezes
edit.
on yours. So for those of you watching this, I just moved, so I'm on a hotspot and she can't always see me. So it's only a fun adventure. But I think my computer's recording them all. So
Oh, good. Perfect. Well, I'm Kellie Stecher. I'm an OBGYN. I'm the founder of Patient Care Heroes, the 7th District Governor of American Medical Women's Association, and the founding board member of the League of Minority Voters for Minnesota. And obviously, physician burnout is a huge passion of mine to tackle because there's so many nuances to this. And I'm excited that we get to have this conference at the end of August. So August 24th to 26th is when we're doing this.
yeah. And I think it's so important to meet together and to talk about it. What do you want people to take away from the event? How's it going to be different,
So, a lot of us have spent the last couple years obviously dealing with COVID. And even before then, the healthcare system had its struggles in terms of burnout and physician and nursing concerns and everything else. And so I think it's important to use the momentum that we have because we have a lot of the attention of the public right now. And if
Right.
we can use this momentum to create change, we might actually have a chance at creating some positive changes for the system. And the way it's structured is you're going to hear from many different amazing leaders across the globe. And for example, we're talking about gender equity issues. We're talking about being a woman in medicine. We're talking about a number of different safety concerns that women in medicine have. I also have a panel that we're doing looking at other equity issues in medicine and how that affects being a physician. And also on the patient side of it, I have some people who are going to be talking about their experiences. And so we're going to label the problems, but we're also going to give you ways to fix it. So I think the way that this is different is not only are we going to address the elephant in the room, we're going to talk to thought leaders around the world to give actual areas that we can work and ways that we can move forward together.
Yes, I love that. I think it's so important. And I just a lot of people talk about it and talk about the problem, or they're just, they just want to do coaching or something. And it's so important to have everyone that goes understand a way that they can help. And I wanted to know too, because I can't participate, but I'd love to participate remotely. So do you have options for that?
Oh, absolutely. I mean, it's all remote this time. And I know that we're planning on
Oh, that's
having
good. I didn't know that.
more conferences in the future. And hopefully at some point we will have those together because that is fun to get to see people network. But you can go to all the events remotely.
Oh, that's really good. I really like that. Back to what you said about COVID, I was thinking about that because a lot of people are leaving the profession and I can understand. I mean, I'm not a physician and sometimes I'm ready to leave medicine. No, it's, it's just really been politicized and
Uh-huh.
it's come to the attention of a lot of people that we're asking physicians as humans to put themselves at risk and to put their families in situations where they don't know what's best and they don't know what to do, and a lot of the times it's in with hostile people around them because the stress that everyone has, they're just taking it has to go somewhere. And I think in a lot of cases it goes towards the healthcare professionals who don't have the answers that people are looking for that don't exist. And I didn't know if you had a few thoughts about that or.
Yeah, I mean, I think the issue that we've heard with burnout and mental health issues in medicine, the onus has been put on the physician or the nurse or the healthcare worker, right? And the issue that I have always had with that is, okay, I can go do yoga, I can go work out, I can go, have a coffee, I could go for a walk in a park. Great. Those are all really good ways to de-stress. However, if I'm put back into an environment that's still toxic, that's still toxic. I'm still going to have the concerns that I had. So I can only control myself. And so I think the biggest issue that I have had, especially in light of COVID, is looking at the overall moral injury of people not being able to fix their environments. And also, systems really need to become more introspective, right? It's not
Right.
just on the physician or the nurse or whoever it is. It is literally a systemic issue in healthcare. We have these hierarchies and people are really they're not supposed to jump in the hierarchy to get things done, right? So people feel trapped in their situations, like they're just kind of floating around hoping that something will be fixed. And that's not good for people's mental health at all. And that's why people are piecing out. And looking at statistics from pre-COVID, you can already see about 40% of women were going part-time or leaving medicine altogether by the time they were 6 years out of residency. That's really
It's
alarming when you
crazy.
consider how much we invest in this education. And all of us have lived our lives in a certain way to get to this point, to get into medical school, to get through residency, to become physicians. And so at the point where people are willing to sacrifice their career because it's such a toxic environment, we really need to look at this more. And I don't know if you saw some of the news reports, especially out of the South, um, Oklahoma, Missouri, Arkansas, we're seeing people walk off the job, right? So, and
Right.
that's more nurses have been reported doing that. However, we've gotten to a point in the pandemic where we have felt like we've done everything we can. There's a vaccine. People are still resistant to the vaccine. People's emotional bandwidth for this stuff is really kind of collapsing. And so we have seen more physician suicide. Even in my community here, we've had a couple young moms who died by suicide, which is like the most heartbreaking
Yeah.
thing to me, because you just think about their family, right? One died a couple days before she was supposed to come back from maternity leave. And so we need to take this seriously. We need to look at the systems that we practice in, and we need to fix the root cause of these problems, because it's not that so and so had depression, right? A lot of these people that have died by suicide actually don't have a history of mental health concerns. However, I hate that people use that as an excuse to justify why things happen. Just like people are saying, oh, well, some of the kids that died of COVID had immune system issues. No, we still need to value people as people. And this
Right.
does not mean that depression automatically leads to suicide. And so I think that
It
because
doesn't.
mental
I
health,
mean, it doesn't,
not at all. I mean, honestly, if you look at the statistics, probably about half of medical students have depression. I mean, they have clinical depression because it's such a stressful time. So we really need to take a step back and look at the structure that we practice in and put safeguards in to make sure that we're treating people fairly.
Right. I think too about I mean, obviously I have 4 kids, so like I think about the mom thing a lot. And also I sat down with someone and asked him, what difference would you want to make in physician burnout? And she donated money to moms, like to making sure childcare happens for those moms so they have better options. And you're in OB-GYN, so like you're probably really close to that. And just hearing about people dying or feeling trapped, it feels like no one has options. And that's so important. And I love yoga. Like I feel like it really helped me through grief, but it's it's hard knowing that you're going into a situation that's lose-lose. Like
Mhm.
people are sick, like you're going to not be able to meet all your obligations. Like um the thing is I can imagine what that's like because I've been in places in my life where I was there. Um like just taking it day by day. So I love that you're doing this work and having those conversations because it's not easy. Like it's so easy for people who aren't ready to have those conversations or don't want to change the system to be like, oh well, like, like those are the crazy people.
Yeah. Well, no, and that's actually like a lot of the things that I find, right? I mean, I was at a board meeting and there was an individual who was thanking this male board member for kind of changing some of the language that we wanted to change. And that I realized in that moment, we're used to breadcrumbs, right?
Right.
Like, why would we settle for maybe a little bit change when
Mhm.
we could actually create changes that are impactful to people and help them
Right.
survive and help them thrive. So much of our life in medicine is fear, right? We're afraid we're not going to get a medical school. We're afraid of our
Or
boards.
even
We're
just in
afraid
general, it doesn't have to be just in
it's
medicine, but
bad.
yeah.
Yeah, we're afraid of being pimped on the floors. And what that means, and I know it sounds like really sketchy, but pimping is when you're literally basically like hazed by your attending and asked a million questions, right? We're afraid that we're not going to get into the right residency program. We're afraid that we're not going to be able to pay our loans
Which,
off.
like,
We're afraid
honestly, medicine, that's not what it is, so
successful. I mean,
educated
it's,
yeah.
yeah, like we're afraid that we're going to suck at it. We've just invested all this time and money and we might have imposter syndrome and all of this stuff. And then we get out and then we're like, okay, well, we're afraid we're going to get sued, even though we're doing the right things. We're afraid that we're not going to be liked enough or popular enough as a clinician, or that we can't keep up with stuff. Or, a lot of women have fertility issues because we waited for so long because we're so focused on our career. So a lot of our life is fear. And then when things come into our realm that shake us off of our core, that maybe threaten our job or our livelihood, like maybe harassment stuff or a sexual assault. I've had
Maybe.
unfortunately known some people who were
Yeah.
at work.
I'm sorry.
Um, babies, be a little because of maternity leave and all that kind of stuff. So when the things come in and shake us off of our core and we're worried about being able to be a clinician and provide for our families, of course we're going to struggle, And so I think that we need to come to terms with the fact that it's normal to struggle and people are going to need to have resources and care, and we need to have grace and kindness with people. And I think that we've really lost the care part of healthcare. And we really need to get back to that because we're humans. We have empathy for our patients. Why can't we have empathy for each other?
Yeah. I think about sometimes it's easier to have empathy for people that are further away. Um,
Yeah.
and I love that you said that. And I love the idea that they'll have ways to get out of that fear cycle, to
Yeah.
do something about it, about about these problems. I just stuttered a bunch.
It's okay. That's how we roll.
Editing that out. Thank you, YouTube channel and friends, for being nice to me. I'm moving.
It's been a long day.
It's been a long day of me not unpacking as much as I should. I want to hear. Okay, one of the things I don't like is when people are always like, "Well, let's hear one positive thing about this." But like, what's one thing you wish people would talk about more?
That's a great question. I mean, honestly, I think realizing what is at the root of some of the struggles that we have in healthcare, and that is gender and racial equity issues
Right.
are a huge part of the struggle. I mean, there's 13% of healthcare CEOs are women, right? Women aren't heard. Women have their ideas stolen on a daily basis. I know female colleagues who've had their research stolen still. I mean, this is like current, like real time, like situations, right? And so I think until we can actually treat women as equals and not just like as the token person on some committee because we have to fulfill a quota, we're not going to make progress in creating a healthy situation or structure or system. And the other thing is, has anyone noticed how Black men are not rising to physicianhood? Like, we don't have an increase in numbers of that community. And why is that? Well, if I knew that I was going to be discriminated against or treated poorly, I probably wouldn't want to apply to medical school either. If I
Right.
if I knew all the things that I would have needed to go through, I would have probably told 4-year-old me, you know what, just kidding, that was a cute drawing that you did. But like, I don't think you
Oh,
really
I
want
wanted to be an OB when I was 4 and 5.
to. So I was 4.
And then I saw a baby be born. And I was like, nope. That's a
Yeah.
no.
Yeah. So I was going to be a pediatrician. I was going to be a pediatric
Yeah.
cardiologist. When I was 4, I was going to do it 100%. That's what I was going to do. Then I delivered my first baby and then I realized I actually did want to be an OBGYN.
I love that.
But, I look at my 6-year-old who says that she wants to be like me and wants to go to medical school. And I think, really, can we steer you to, I don't know, being a vet or something else? Like, I just can't imagine And that's why I'm so passionate about what I do, though, because I'm hoping that by the time she is old enough, we'll have fixed some of this stuff. We'll have maybe created spots at the table for everyone so that we can create the changes that we need.
Right. I think about some of the experiences I've had where I've gone into conferences or situations where I wasn't necessarily welcome or supported, and that view for the future kind of helps. Like I want my daughter to take it for granted. Like at one event, some women pulled me aside. They're like, we would never have been able to bring a baby when we were
Mhm.
moms. And they said it in a way that was like not nice and not supportive.
Yeah. Yeah.
It was
Yeah.
like, what are you doing? And I was like, I'm going to do this. Like, I'm asking for more because someone has to. And like, I have 4 kids. Like, I don't really have an option here. Like, what do you want me to do? Quit and like go live on the farm or something? There's no farm.
Exactly.
Um,
Yeah. I mean, you
so
need healthcare, you need a
yeah,
roof over your head, you need to feed your kids.
right. So that future view for our kids, like, wouldn't it be cool if our daughters would say, well, things used to be bad, but like now we're pushing for something more, something that you and I could never imagine.
Right.
So I'm really looking forward to like learning more. Um, I'm going to share it online and hopefully everyone who's watching this, like all of you, there are going to be so many. Just I'd love to hear the experiences other people have had in medicine and that underlying idea that the reason that we have problems here is that inequality still exists. And I'm really grateful for people like you who are working against that and are going to make that better.
Yeah,
Okay.
one
Well,
day at
thank you
a
for
time.
coming to my short video. We're going to talk about the summit more. Um, yeah. And I hope you have a fantastic day. I'm going to stop recording now. See, I think you're supposed to, yeah. See, I'm very good at this YouTube thing. Very good.